This portion of Carlos and Lisa is brought to you by Scan Health Plan.
We're here once again with our friends from Scan Health Plan. As our viewers have learned, Scan is a local Medicare Advantage health plan for people who are eligible for Medicare. Scan joins us regularly to provide important Medicare information and updates for our viewers who are 65 and older. Welcome back, David and Holly.
Hey, Carlos. Good to see you again.
Today, our Scan partners are joined by Brian Smolskis. Brian, I see you're the president of PIH Health Physicians, HealthMed Services, Inc., and PIH Healthcare Solutions. Welcome. You're in good company with our friends Holly and David. Now, can you tell us exactly what your healthcare organization does?
Certainly, Carlos. PIH Health is an integrated delivery system, which means that we have both hospitals and medical group. In addition to that, we also have our own home health agency and hospice services and hospice house. We service Los Angeles County and northern Orange County, as well as the San Gabriel Valley. In our medical group side, for which I'm the president of, we have over 300 physicians in our medical group in a little over 80 offices in 28 different physical locations.
Wow, that certainly represents a large footprint of hospitals and healthcare providers here in Southern California. And David, I assume that PIH Health is aligned with Scan Health Plan in providing health care to Scan's members.
That's right, Carlos. As a health insurance company, Scan relies on our hospital and physician partners to deliver health care to our 220,000 Medicare members. PIH is an example of one of those trusted healthcare delivery systems that our Medicare Advantage members can access in their local neighborhoods.
Holly, I noticed that David mentions local neighborhoods. As I recall from previous broadcasts, you repeatedly mentioned the importance of local licensed insurance agents. This local concept seems to be an important message point from Scan as you reach out to people who are eligible for Medicare. Now, why is that?
We think the local concept is critical. As opposed to the large, nationally marketed health plans, Scan has a 45-year local history as a company headquartered in Long Beach. And our nonprofit plan depends on local insurance agents who represent all healthcare options, as well as Scan's Medicare Advantage plans to people eligible for Medicare. We stress the importance of the local concept consistently because no one knows your healthcare neighborhood as well as local agents who help people in a one-on-one setting find the best health plan, hospital, and healthcare providers for their specific healthcare needs.
Now, Brian, David mentions Medicare Advantage plans. I know that Scan is a Medicare Advantage prescription drug plan. I've learned that they are called MAPD plans, and that Scan feels they are very much a better option for people over age 65 than if they enrolled in original Medicare. Now, I'm curious, as the president of a regional healthcare network, would you agree that an MAPD plan is a good option for seniors?
Provider organizations prefer Medicare Advantage over traditional Medicare or fee-for-service Medicare because Medicare Advantage is really set up to take care of the patient by keeping them healthy. In a fee-for-service scenario, the way a provider is reimbursed is when a patient gets sick. In a Medicare Advantage world, a beneficiary is set up with a medical group, a physician, hospitals, and they're set up in a preventative maintenance way. You know, think about it, how you take care of your car. You know, we take care of patients. We do things where pre-screenings, we do mammograms, colonoscopies, all these things that you can get through fee-for-service, but you have to remind yourself to do those. In the Medicare Advantage world, we are set up to be able to manage the patient's care. We are incentivized to keep patients healthy, and we are incentivized to reduce overall expenses by making sure our patients stay healthy.
Listening to Brian speak from a regional or local healthcare network perspective certainly reinforces our messaging around the importance of dealing with local, licensed insurance agents who represent all health plan options and have in-depth knowledge of hospital and medical groups in local California neighborhoods. We recommend your Medicare-eligible viewers ask their friends, their doctor, their pharmacist, or other trusted advisors if they have a name of a local agent who could help them make their insurance company choice. And of course, we think Scan Health Plan is a plan they should certainly consider.
Well, once again, I feel I've gained a great deal of insight into things that people 65 and older should consider when selecting a Medicare health plan. Now, adding that perspective that Brian brings from the hospital and physician's point of view certainly clarifies why plans like SCAN's MAPD plans are such a good option for Medicarians. I look forward to our upcoming segments and learning even more about the importance of shopping locally for Medicare coverage. Thank you, David and Holly, and it was great to meet you, Brian.
Thank you, Carlos.
Thank you, Carlos. Good to
Thanks,
see you
Carlos.
again.